So good morning, everybody. It's nice to actually have been able to log in. So I'm glad we're here. Pat, where do you want to start?
Well, I think you probably want to take them over to the Wraparound Ohio website and kick the lift the hood and kick the tires under that community resource form, right?
Yes.
So, do any of you have your browser open? Any of you shopping while we're having this discussion this morning? That was a little joke.
If not, I have my browser open so that I can show people where to go.
Okay. Well, you want to share your screen and we'll kind of walk on over there. Are you going to stay with us, Neil? I appreciate you rescuing us. I hope you felt like you were kind of the guy on a shining, the knight in shining armor. I know it's been a while since you got to feel that way, right?
I know it. But actually, I'm going to go finish what I was doing. But
okay,
I may drop back in. Thanks, you guys.
We appreciate it.
Thank you, Neil.
Oh, wait a minute. I have to make you host again or somebody host again. If I leave, it'll.
Yeah, please make Pat host.
He is. There you go. Now I can go. You are now.
Host now. Okay. Thanks a lot, Neil.
So
are you sharing your screen, Nancy?
I will do that right now. So hold on here. Now, let me go again to share screen.
So for those of you who are following along on your browser, the place to find this is the Wraparound Ohio, it's wraparoundohio.org website. And if you go to that website and you see the gray bar, which Nancy is moving towards now, you can see all kinds of stuff. But if you get over to FCFC service coordination resources and you drop down to tools, that's kind of a treasure trove of different things that can be helpful in the work you've done. For those of you who were around, we tried some of this when it was a little fresher, but we wanted to go over one forum today around selecting community resources that Nancy and Jenny and Amy worked really hard on to try to make it a way to kind of navigate. We tucked it under the FCFC resources tab under the healing stage.
So in this case, you would from the browser, I'm going to go way back to, as a matter of fact, I'm going to close this. I'm going to open, all you have to do is type in Wraparound Ohio. You do not need to look for a specific, just by putting in Wraparound Ohio, it takes you on a Google search to the Welcome to Wraparound Ohio website. So you don't have to know the address. You can just go to that through Google. It takes you to this screen, and then you look for Family and Children First Service Coordination Resources, Tools, and based on the stage, you'll come to any number of different tools. This one happens to be the first tool under the healing stage. So it's the resources worksheet. You'll come to this page that says tools for the healing stage resource worksheet. You can access this from any number of different places. You can download it from here, or you can press on this cute little icon and it downloads it. Or, I got to keep moving our faces here. You can close that out, and you can press on this icon on the form. Any one of those three will bring you to the Selecting Community Resources worksheet. You might also recognize this, as long as I'm showing you this, from your service coordination handbook. The service coordination handbook also has this form on it, pages 49 and 50. So there's an overview that explains the form, but then this form, the actual tool is this worksheet. So with that introduction, Pat, you want to start leading and I can.
Yeah, we'll walk through it. And, I know Jenny and Amy worked on it a lot too, so feel free to jump in around this. But this, we envision this as a way to organize around resources. It's interesting to me when I listen to parents and youth, and they talk about what made a difference, people that surprised us against all odds, they never talk about the program. They never, quite frankly, they never talk about the resource. They always talk about the relationship. And yet, when I look at kind of what happens on a policy level, we know that navigating to resources can make a huge difference in the short term, so that you can get the time to really focus on the relationship over time, that you can go with families where they're going to go. And so what we wanted to do is come up with a way to kind of structure. The other thing we were structure the way you navigate things on behalf of a family. The other thing we wanted to do is put some logic to it, so it didn't feel like you were just throwing everything in the kitchen sink in a family, that it was a way to kind of slow down teams. So the structure of the form is around 3 areas: basic needs, all the things that we all know about, support needs, and service needs. And
they're handily color coded, so
which took a lot.
Page 1, 2, and 3.
So, off the top of your head, I know we've got a lot of service coordinators in here. Have any of you ever worked with a family with basic needs, that you had to come up with resources around basic needs? Tiffany, I see you shaking your head. Is that at us?
Yes.
That was an affirmative?
Yes, I was saying yes.
Okay. Wanted to make sure. Wanted to make sure you weren't playing blackjack or something at a casino saying, yes, I won. But so if you just think about that person, think about that child and youth. If you look at this form, what it allows you to do is populate the child and youth's name in the box. If you can go ahead and just put in any name, Nancy. And then that populates on all following pages. So it's going to populate, even if you're just focused on basic needs. Then you put the family need in, or the family name in, and then you move over to the date, and there's a drop down. There is a drop down, so you can easily pick the date. And in this box, you can highlight the concern around the family. So Tiffany, just off the top of your head, as you think back to all the families you've worked with that have basic needs, what's an example of what you might hear from a family around basic needs? What's a concern you might hear?
Food shortage.
Food. We just don't have enough food. Is that right?
Yes.
And is there anything else that a family might say?
Usually I'll hear that the housing issue is a big one for me. Of course, like I said, food or transportation, trying to find busing, things like that.
So it might be, so the family, the parent might be saying something like, I got these big kids, they eat all the time, I'm working 2 jobs. Does this sound familiar? I'm working 2 jobs. I have to live with my mother. There's not enough room for us. And my car keeps breaking down. Is that sort of the way we might hear that story?
Yes.
And what I will often hear with parents at that moment is, yeah, I'd like to do better by my kids, but if you got a better way to approach this, I don't know what to do. They're growing boys. There's not enough, any of that stuff. So something around kind of what we would typically see in that box is, the stuff going on at home is causing things to be hard for the family, or it may, we may see, the kids get mad and there are fights that happen. And so moving down into that first column, if we-
Before you go on, Pat, for 1 second, this is the point where it's important to be aware of the specific situation. In your case, it was insufficient food because growing boys and we just don't have enough. But sometimes the food issue might be we can get sufficient food from a pantry. We just don't have any way to get to that pantry to get food. And so they might be saying food is the issue, and through your discussing it and getting the details about why there's insufficient food, you might find that really that the issue is more of a identifying transportation to get to that. Or it might be that we don't have the income. See, this is good because we got to look at why is food so big and income support so little. So that we'll get to some glitches when we're going through this, but it might be that, yeah, income is the reason that we're not able to have it. So it's that detail that matters. Go ahead.
So if you go down to the first column, you'll find there's a drop down there, which allows you to break in or break down kind of the steps that you want to break down. Because in my experience, if people say food, it's just like what you just modeled for us, Tiffany. It's never just food. It's food and then housing and then gas and then the car. And then and then my oldest boy has celiac and I just found out. And it's never as simple as we think it is in my experience. And so, and I think you guys sit right there where people can feel pretty frustrated with the family. We got them a food box. Why is this still a problem? Well, it's still a problem because the housing's not stable, the car doesn't work, the kids got celiac, there are medical concerns, and I'm paying off, I don't know, something from before. So you can break down and pull out one thing. You can pull out food, shelter, clothing, identifying people I can turn to about basic needs or income support. And you can start to break it down as you walk through it from that pull down menu.
And this is one where there might also be the combination, like we talked about, food is an issue, but under the support needs, you might be able to add the transportation. So it's the same concern that the family has, but they need both the food and they need the transportation support. So there are that's why you're looking at the different sections, which is a basic need, which is a support need, which is a service need.
So the next question is, why does this matter to the family? Because again, we've all been there where we've taken care of the surface issue and didn't address the underlying issue, right? Because what can then happen is people get frustrated with the family because they didn't get better when we got them the box of food. So why is the food important to the family? I'm trying to keep my boys close to home. Maybe I'm worried about them being at risk somewhere and there's not enough food for them in the house. And it's not the kind of food that most teenagers would like. So instead of, on the surface of things, we may think the issue is a sandwich. The issue may be safety. The issue may be protection. The issue may be all kinds of other things that kick in. And so you can identify why it matters to the family in that column. And then go ahead.
Oh, I was going to say, so Tiffany, why did it matter to the family you were thinking about?
The one I'm thinking about is their stress. They get food stamps, but every time at the end of the month, they were always running out. And every day they were counting down because they were fixing to be out of food and fixing to be out of money to hold them over until the next time they got food stamps. because the boys were growing. And so she just had the stress on her shoulders of trying to figure out where to get it each time.
And even before the food ran out, she was stressed, which was affecting the child's behavior. Okay. And you can see as Nancy's typing, the form will, the letters will shrink, so you can put what you, if you want to write a book in there, you can write a book in there. You may not be able to read it, but you can write a book in there. Then moving over to the local options, what gets interesting to me about Tiffany's example is we started with, well, let's get them a food basket. But now I'm beginning to realize that it's the food basket is more than a food basket. It's also a stress reliever. And so what do you guys do around stress, right? I mean, that becomes kind of an interesting issue. What did you do this morning when you couldn't get on? What Nancy and I did is started texting each other. And then I called Neil because, you know, Neil can usually fix something and he likes doing it. So, you know, we think about what is the stress reliever. If you can go back up to the food, Nancy.
Yeah, will do.
So this one gives you, you can identify local options. So when you think about people who are running out of food at the end of the month, what are some public options that you guys have available?
Oh, we have Care and Share. And we also have OGO.
What is OGO?
They are, well, that'd probably be more private, but they are where you can go and get emergency food. And they also have a bus that goes around to the different parks, and they park where people can come and get boxes and stuff of food.
Oh,
And they
okay.
also partner with our JFS, and they're there once a month to hand out food.
Cool.
So is that a nonprofit organization or a community church-run kind of organization?
It's its own nonprofit.
It's its own nonprofit, OGO. Huh, interesting. I'll put it under nonprofits then. What I like about this is that it gets people to start thinking, yes, there are the public options of food stamps, but they're already getting food stamps. What's Care and Share?
Care and Share is a place where when you go in and you say how many children you have or how many is in your household, you get to kind of grocery shop. They give you clicks and you can go through and use those clicks to get so many items. And then they also have like a clothing area and like household goods, and you can go over there for free. Doesn't matter how many clicks you get, but you can visit it so many times a month.
And is that also a private or a nonprofit organization?
Cindy, what would you say? I'm not really sure.
I want to say nonprofit, but honestly, I'm guessing. But
Yeah.
And you know, it doesn't matter. It's just the idea of
It's the idea of thinking about the possibilities, because here's the other thing. We can get, those sound like great resources. The other thing is people do matter, right? So, you know, I would say, okay, are there any other people around in your life? I mean, do you know, I'm a grandparent. So if I knew my kid was getting stressed at the end of the month, they had enough food most of the month, but at the end of the month, yeah, the kids, the grandkids like this particular thing. I can make that near the end of the month. That's just about scheduling. As a grandparent, I might be doing it anyway, but it's about kind of scheduling in order to address the stress relief. And in that way, food becomes a healer, not just a sandwich, if that makes sense. And so we might look at a grandparent or a relative or a friend, or we might find that this parent is really, really generous when her food stamps are in with her friends. And so there may be an opportunity to talk to her friends whose maybe their food stamps come later in the month, and that we can share some of that stuff. So we wanted to also include people as well as clubs and groups if they became. The next column really asks the eligibility question, and that's a drop down as well. And there's 3 possibilities. Yeah, no, and maybe. And
So
so
we-
you, go ahead, Nancy.
Oh, I was going to say, and so we know that in this case, the family is eligible for food stamps, but there might be others who are not yet on a food assistance program. And so maybe the question is, or the answer might be, maybe we have to check it out. If, on the other hand, the answer is no, it's not a, oh, then we're stuck. Rather, it becomes, all right, if they're not eligible for food stamps, what else is available? Do we need to look at the private sector? Do we need to look at people? Do we need to look at clubs or groups or nonprofits? And what are those? So we don't want the eligibility to be a, oh, too bad, you're stuck. We want it to be a motivator to look at what else might be available.
Nancy, I've found recently I've gotten insurance will help sometimes pay for food as well and utilities, and I've kind of pushed my clients into kind of that direction.
So their insurance provider will sometimes do that. And that's what I love about people working together. I've never heard of insurance being willing to do that, but whatever insurance is this family on Medicaid?
Well, actually with Care Source, if you take your kids to the doctor or yourself to the doctor, you usually get $25 to $50 back, and that will go to a Kroger card or a Walmart card. Or if you have like United Healthcare, you can get, depending on what plan you have, you can get up to $133 for groceries that month, up to $150.
So that the Medicaid managed care plans include
Food
assistance.
subsidies.
Yeah, very nice. Yeah.
So you walk down, you say yes, no, maybe, and that kind of leads you to a place. The next column is really about checking ourselves. You know, we like to say that we do these things, that we're strength-based, that we're driven by family, that we're collaborative in our approach, and we're addressing an underlying need. And so you can pick the strategies based on where you're going that apply. What I like about your example, Tiffany, is again, we started with a sandwich, but we ended up with a stress relief mechanism. Because here's the thing, if we just give a family a list, a parent a list, that parent a list, it's probably just going to stress that parent out even more to try to get through the list. And so then that gets you to the follow-up, which becomes very clear if you're in a team meeting, for example, or you're trying to work a team-based process. What becomes very clear is we can't just give the person a list. We're going to help share the burden of finding the food at the end of the month. And that shouldn't always fall on the service coordinator. And so that takes care of the first kind of issue as we think about it in terms of basic needs. You can fill up this whole page with basic needs, not go anyplace else, save it, print it out, give it to team members, however you want to do it, or you can move on to the next page.
And in terms of saving so that the family has it as well, you can print either the whole kit and caboodle, or you can say, I just want to print page 1. And so you don't have to be stuck with tons of paper that you're passing out. You can, in fact, just print what you want to from the form, from the worksheet.
Comments, questions, thoughts? Talk to us. Can you see using this? And how would you use it? Because once I hear that, I'm going to have a better question for you.
I think it would help me brainstorm and keep, a thought process of how to work out from A to Z. Because a lot of times, like you said, you think about food, but this makes you think about every, area and why they need the food and stuff. So
I can think of 2 times when it might be, I would consider it helpful. When I get a referral, a lot of times I do kind of this kind of thing, like what do they have in place? And what is that servicing, or what need is that meeting? So I think initially, like right off the bat, this would be very helpful for me to put it all in one place and look at what's already in place. But I also have had cases that seem to hit a wall and we just don't know what next steps are. And I can see where coming back to this, maybe adding on something that I've added along the way that I didn't have on this form will help me kind of reshape, what moving forward looks like. Are we still headed in the same direction we were before, or does the direction need to change, or what did we miss? What is now clear maybe that wasn't clear when I was doing the intake?
Oh, that's interesting to me, because I could see early on, as we all do, if somebody's having a hard time, if the gas is leaking, we turn off the gas. And then we kind of say, well, the gas is leaking, we need to get help. And then we may leave. The gas may get turned on without it being fixed. Or there may have been 2 leaks. And so we fixed the first leak, but not the second leak. So going back as a way to kind of check and say, did we really understand why we were going in the direction we were going? I can see that being a way to kind of check yourself and check the team and say, how do we need to sharpen our focus a little bit? I like that.
How else do people see using it?
I like the tool where it has the private piece, because I think that is going to open up conversation about implementing natural supports. And I've not been at it for very long, but in my experience, those natural supports aren't really something that families have just been ready to engage.
Mm-hmm.
I think if you're using it, actually, just like you said, throughout your entire time that you're working with the parent, you're just kind of coming back to that, and wherever you start with, you're just kind of just from conversations and things, just checking in about the community resources and what they're needing and what they're using. Again, I like that it has the clubs and the groups there, especially because it's something to remind you, you may have a family. And I've had this in the past where, someone new to the community, and they don't really have that much of a support system. And so if you can direct them, like especially mom maybe needs some supports, be able to direct her to local, whether it's churches she's interested in or whatever. I like that that's there. And then also for the youth that's involved as well.
I'm going to jump in just with the idea that a lot of times the needs that people talk about the most are these basic needs. But I really was pleased that Family and Children's First also saw the importance of including the kind of service needs. And also looking through, because mental health isn't always helped just through counseling or therapy. Sometimes mental health is helped through people having connections with other people, with participating in clubs that or exercise or yoga, something that meets their mental health needs. Substance abuse, there are any number of different, yes, there's substance abuse treatment, but then there are also programs. But when you think about it, Bill and Bob from AA were friends who talked to each other about how they were going to stay sober. And so that a person might have another person in their life who was able to maintain sobriety, or and so getting them to think about that. And it's not always just the parents. Sometimes there's a grandparent who might have some needs that, if those were met, they might be more available to the family or the child or the youth. So just in being able to look at any number of different options under the service needs, I think is also widens this tool.
So can you go back down to your pull down? I do want to pull out I want to go under older adult, go to the building professionals who I know and trust. One of the options under that is this idea of building professionals who I know and trust. You all see families that are going to have system contact at different times around their lives with their children. And I really appreciated that was included on the list, because if you've ever navigated any kind of complex health system at all, you know the difference between knowing somebody who knows who you kind of feel like you can tell your story to, and somebody and feeling like you're just a number. And so the personal part of that, I could see that one coming up quite a lot as you guys are transitioning from a family formerly in service coordination to families not in service coordination, to make sure that they have connections with people. I work with a fairly large, well, the largest geographical area in Georgia, and they have schedulers at their mental health centers. And the schedulers have historically been assigned to therapists, and it hit them a year ago. We've got to quit assigning these schedulers to therapists. We need to start assigning them to families. And as soon as they did that, their no-show rates just plummeted. Why? Because the scheduler knew them. They could say, oh, how did those dumplings turn out that you were cooking last week, when they called to remind them of the appointment. So that's another piece of this, which is, I think, very personal in terms of not just kind of, here's the intake form, but I need to know that it's a place I can go back to. And it feels like that's an important conversation.
I think, Cindy, you talked about, I'm talking to Cindy when she's not around. When Cindy was talking about using it at different times, I think that's where you look at this in the strategy area. Initially, you might be doing something based on a family preference, or it addresses the underlying need. Later on, you might recognize that in this new, after we've had a team meeting, we recognize a strength that is part of this family's story. And from that, start saying, oh, you know what, let's go back to some of these service or support needs. And now we know that there's this that builds on your family's strength. And so you might change the strategy or the intervention that you're using there, choose a different option, because it does build on the family's strengths. Are there any other examples you want to go through at this point? Any thoughts, any questions?
I had a question. This has been on our website for, we've posted it now almost a year. Has anyone used it yet? Has anyone downloaded it and used it? And do you have anything to share on if you've had success with it?
I'm looking for it on your website, Jenny.
It's in the Service Coordination Handbook, pages 49 and 50. And
Okay.
that may be why it hasn't gotten used. You know, it's kind of part of that whole, and that's why we wanted to introduce you to the Wraparound Ohio website, because we really do think that some of these tools might be easier to access by going to the Family and Children's First drop-down on the website.
Nancy, it's a separate fillable document on our website as well. So it's part of the full handbook, but it's also a separate document. So if they are on our website reviewing the handbook, they don't have to download the entire large document. They can just access the fillable document.
And I'm looking for it. I keep saying I'm looking for it. And I went to your link and it got me to the resource page, but I'm not seeing it.
Then let me show you where I got it. Let me stop sharing my screen for a second so that I can go into Service Coordination Handbook. And
I found that one.
Okay, so hold on.
But I haven't found the fillable form on your website.
1, 2, 4, 5. It's the seventh bullet down.
Handouts, the one labeled handouts.
Oh.
Nope.
Let's see. Hold on here.
It says selecting services and supports, and then there's a tab of selecting services form fillable.
So when I got to the Ohio Family and Children First Service Coordination, yeah. And then, yeah, go ahead.
So you can go just to the handout.
I found the handout. I found it. That's my guess is that we need to, if you're wanting folks to go there, we might want to highlight that somehow, maybe in bigger print or something, because it took me a little while.
Nancy, it's if you go back to our website, it's its own bullet, just the handout.
All right. All right. I'll just close that off. Let's see. I must have pulled that up from somewhere else. So, anyhow, Pat, do you want to show where you got that instead of having me like search for it at this point?
I can.
All right.
So getting to the to your website, if I come down here, I find the selecting services and supports. That takes me to the handbook, but this brings it down as a separate form. And there's what this one has is it's got guidance on the front page that describes what to do. And then here is y'all can see that, right?
Yep.
So now that I found it, thank you for, have any of you downloaded it and used it? Now that I found out where it is.
I'm going to just jump in here real quickly. I have not used it yet because I forgot about it. I do remember having this discussion in one of our meetings and thinking it is a great resource, and I will use it from now on for sure. But I do have kind of a question to the group. How does anybody see this fitting in with OASIS and how we do our family plans? Because I think it's great information to be able to like put it all together. Instead of kind of having to do some things through OASIS and then printing this off separately or downloading this separately. Just some thoughts, I guess.
And Beth, this is Colleen. I do want to let you know that when we were working with Nancy and Pat and Sharon in the COE to develop this form that we've been discussing today, we had a lot of conversations about OASIS. And at least at that point, we felt very strongly that since this is not a required form, we didn't at that point feel like we wanted to force you guys to fill it out in OASIS. So we did have conversations about how if you were going to use the worksheet, the last column talks about like who's responsible and what the next steps are. And so you could possibly utilize those to help develop your goals and your actions as to like what the next steps are based on, you know, the outcome of that worksheet. But at least I'll respond on a functional, but then obviously others definitely can respond on like practice. But we can always look at whether or not in the future we'd want to develop this or something similar in OASIS. We just felt really strongly we didn't want to force you guys to fill out another form that was optional, at least at that point.
And I totally appreciate that, because that means that you guys understand like what we're all doing and the work that we're doing. I have fallen in love with OASIS. I love it as a tool. So I guess to me, I'm like, oh man, this would be great if I could just hop onto OASIS and this was on there and I could be filling this out at the same time as I'm doing all the other paperwork and information. So kudos to you guys for working on OASIS, because I love it.
Thank you. This is recorded. Thank you. I might put that on my replay. Sorry, Pat, go ahead.
You put that on your voicemail, right? I'm not here, but listen to this. I like it. Any of the tools that you see in that service coordination section that have been developed over the last year or so have been guided by the principle of these are tools, not necessarily required forms. So our hope is that you start to treat that like your own kind of, I don't know, junk drawer. You know, everybody has a junk drawer, and in the junk drawer is the putty knife that you can use to, you know, align this, or the screwdriver that only works in that one piece of electronics, or that weird tape that makes the table sit level. And so, you know, and maybe we should call it the service coordination junk drawer, but we hope that any of these can be things that you can easily access. And then if you are feeling stuck, as Cindy said, you could go, oh, well, maybe this would work. Pull it out and try it. Because sometimes I think in talking with families when you're stuck, having a third thing to focus on, to do together, to fill out a form, can get the conversation restarted. So the way to think about that is as a series of tools. And then I think over time, your folks can figure out what pieces could go into your OASIS platform. That would be helpful.
Well, we are almost at time. I want to really thank Nancy and Pat for joining us this morning and providing this tool and walking you all through the tool. We hope that you get familiar with it and find it beneficial. We have put in the chat the link for a feedback survey. If you all please it's a very quick survey. If you just take a moment to copy that link and go in there and fill that out, that would be greatly appreciated. Thanks to you all for joining us and for sticking around. We apologize for the technical difficulty earlier at the startup. So we really appreciate you guys sticking around and joining us. And we hope you all have a great day and join us in August. We'll be providing another Toolkit Tuesday. That topic is on positioning yourself to be effective in service coordination. So we hope you join us then. Thanks, everyone.